In 2013, it is estimated that among U.S. women, there will be 232,340 new cases of invasive breast cancer. Breast cancer is the most common cancer among American women, other than skin cancer. There are different types of preventative detection of breast cancer. There are mammograms, self-examinations, genetic testing, and, like in the case of Angelina Jolie, elective mastectomies. Another common way to detect breast cancer is through a technique known as thermography. Dr. Sherry Tenpenny is board certified in both holistic and integrative medicine and osteopathic structural medicine. Her articles have been translated into 7 languages and have been published on popular internet sites such as newswithviews.com, naturalnews.com, and the Huffington Post. In addition to speaking around the world on natural health topics, she has lectured at Cleveland State University and Case Western Reserve Medical School. Dr. Tenpenny opened Tenpenny Integrative Medical Center in Cleveland, Ohio in 1996, where a wide variety of natural solutions for chronic conditions and prevention are offered, including non-invasive infrared breast imaging, more commonly referred to as breast thermography. Dr. Tenpenny, welcome to the show.
Thank you. Thank you for having me.
Dr. Tenpenny, what do you think about this national awareness on breast cancer?
I've always thought that that was the wrong type of focus. I don't think that we should be focusing women's attention or businesses or anyone else's attention on breast cancer. It would make so much more sense if we would focus on breast health and what we could do to keep our breasts healthy and to avoid getting cancer in the first place.
Absolutely. What is the difference between a mammogram and breast thermography?
Breast thermography is infrared breast imaging. It is a way that you can use a non-invasive, no compression, no radiation scan of the breasts. They look at both breasts bilaterally, and what they're looking for is asymmetrical heat patterns. So it is a preventive test. It looks for the status of the health in your breast, as opposed to what mammograms do, which are trying to identify disease. Thermography is one of the earliest changes that you can possibly see that things are occurring in the breast health, because if you have an abnormal cell that's starting to grow, it requires more circulation. As the circulation grows into that abnormal area, there's more blood flow. When there's more blood flow, there's more heat. In fact, some of the earliest studies that were done with breast thermography were done in the 1990s. They were very large studies that involved anywhere between 30,000 and 60,000 women, and they showed that that was the earliest signals of something maybe developing or evolving inside of the breast tissue when those thermography patterns started to change. Unfortunately, that entire body of research and information was thrown underneath the bus in exchange for mammograms. And it's unfortunate because thermography identifies and assesses the status of health in your breasts, where mammograms are there to identify whether or not you have disease.
Dr. Tenpenny, why have the standards for starting breast mammograms changed back and forth between a baseline starting at 50 years old versus 40 years old?
Mammography in the U.S. and worldwide always started at the age of 50 when the vast majority of women had reached menopause. The reason for that is that prior to menopause, that period of time between 40 years of age and 50 years of age, women are still having menstrual cycles, and that estrogenic stimulation to the breast tissue increases the risk of damage being caused by radiation to the breasts during mammography. We dropped that age from 50 down to 40, because 50 years of age has always been the international status. We dropped that back to 40 about 15, maybe 20 years ago, because there were a lot of women who were developing breast cancer in their 40s, and the breast cancer industry really wanted to identify women in their 40s at an earlier state in order to treat them earlier. The problem is, in my opinion, is that as we did that, those women had breast tissue that was much more sensitive to the effect of the radiation, and inadvertently we may have been causing more breast cancer by radiation stimulation. So now the standards have gone back to 50 years of age, which I think offers a perfect opportunity for breast thermography to come into the forefront and to assess women's risk factors and to the status of their breast health in that time frame between the ages of 40 and 50. When they find an abnormality on the thermogram, that they can change their lifestyle, change nutrition, take breast health supplements, and actually do things to make their breasts healthier to hopefully delay or avoid completely the progression from an abnormal thermogram into a full-blown cancer.
Doctor, can you tell us more about what breast thermography is and why haven't more people heard about it?
Breast thermography is infrared imaging. It uses a small camera that just looks at the breast tissue for patterns of heat and asymmetry, that there may be a very large pattern on one breast but not on the other. Thermograms are scored on a scale of 1 to 5, with 1 and 2 being normal, 3 being equivocal, maybe there's something there, maybe not. 4 and 5 are considered to be high risk, but that does not mean that it's diagnostic for cancer. Thermograms were never meant to be standalone assessments. The FDA approval for breast thermography, which was done in 1982, approved this tool as an adjunct to mammography to assess a different type of concern that may be evolving in the breast tissue. Whenever a pathology or a disease state starts inside of a human body, it starts with changes inside of the physiology, that things just aren't working very well. As that goes on, if we don't do things to heal it and change it, as that pathology evolves, it eventually gets to the place where conventional medical tools, as we know them, can identify a cancer or a lump or something in the breast. So these very early changes in the physiology are where the value of thermography is. Most people haven't heard about it because it's generally not covered by insurance. And conventional doctors really don't understand nutrition, lifestyle changes, and supplements to help the breast heal. So therefore, if they did a thermogram and they found an abnormal one or one that showed high risk, they didn't know how to appropriately advise women how to change their breast health and to restore health to their breast tissue. They would just say that it was a false positive, it was a waste of their money, and that they shouldn't even pay attention to these breast thermograms, even though they showed in many studies back to the 90s, if you had an abnormal thermogram and did absolutely nothing to try to identify it, 60% of those women over a 10-year period of time definitely went on to develop breast cancer.
Dr. Tenpenny, you mentioned that the FDA did approve thermography. Why do you think conventional doctors still disregard breast thermography now?
In 1982, breast thermography was approved as an additional tool to assess the level of health or disease within a breast tissue. It was being used at that period of time to screen women for possibilities that they had issues that were happening within their breasts. However, it never really came into a standardization with which the insurance industry began covering it. So as we know, most things that are not covered by insurance are not used in conventional doctors' offices. So unfortunately, the very large body of information, science, and research that was done all the way through the 90s was actually disregarded by conventional medicine, and therefore the tool is unfortunately not used.
Thank you, Dr. Tenpenny. I want to talk more about thermograms, but we need to take a quick break. Stay tuned for more from Dr. Sherry Tenpenny right here on WHDT World News.